We've been working on smart, responsive organic polymer nanomaterials that we can program to target to biological organisms. We're particularly interested in separating out different types of bacteria, not by species, but by how you treat them clinically. So you use one type of antibiotic to treat a gram-negative, a different antibiotic to treat a gram-positive, a completely different class of chemicals to treat a fungal infection. So what we're developing is a rapid sensor that binds to, it can pull these bacteria out of a biofilm, which is one of the most challenging things about treating them, and it sticks them down, agglutinates them, it's like a super glue, holds them in place, which means we can detect them. We've got an assay that we've taken to preclinical efficacy and safety trials, which the device was worn for 45 minutes, took 10 minutes to develop, and it gave us complete success on the kind of information you need to do initial prescribing of treatment. And they got that result in 1 hour, no laboratory infrastructure, no trained microbiologists or pathologists required. It can be done by individuals or palliative care workers. The problem we've got is everyone needs this. Right across the healthcare sector, there is evident need. We've got a material, but what's the point of entry where we take it to market? Are we looking at urinary tract infections? Are we looking at open wounds for diabetic ulcers or immunocompromised patients? We've had a lot of conversations with the global world because needs are different in the UK versus tropical climates. We've had so many choices, we don't know where the point of entry is. And that's what I'm really hoping the ICURe will help us settle down and say, no, this is priority 1, 2 and 3, what we need to focus on. And I think if we get that focus, if we can say, yeah, this is the minimum viable product, this is one we want to take forward, we'll get out of this paralysis of opportunity and into a point where we actually are making a difference and doing some good for the world. We're privileged to have been able to file 2 international patent families. They were sent out before COVID, which means they've been granted, which is fantastic. But we're now cutting into that 20-year lifespans before the patents expire. We've had this ticking clock in the back of our minds for a couple of years now. Having ICURe, it's going to be a challenge, but I think that's a good thing. It's a driver to get us moving, and hopefully by the end of the 3 months have achieved something which we've been talking about doing for the last 2 or 3 years, but we haven't done it till now.